Hi, everybody. In Chapter 20, we will talk about some important infectious diseases of the nervous system. To start, your book has at the beginning of the chapter basic anatomy that you might want to review, but we'll touch on a few points here. Keep in mind that your central nervous system is xenic. In other words, it's sterile. There are no normal microbiota, and there should not be any microorganisms present in your CNS. So, how do organisms get in there? This usually happens through breaks or exposures of the CNS. For example, if you experience a physical trauma or there's penetration of the meninges, which are the membranes that cover and protect the brain and spinal cord. It can also happen through a medical procedure that accidentally introduces organisms into your nervous system. In other cases, some organisms, such as the one that causes rabies, travel up through the peripheral neurons and gain access to the CNS by causing infections and killing the cells of the meninges, resulting in meningitis. There are two basic ways which we can develop diseases that affect the central nervous system. One is by direct infection on the CNS cells or neurons, as with meningitis, both bacterial and viral in origin, and Hansen's disease, more commonly known as leprosy. The second is by production of toxins by bacteria in other places in the body that ultimately affect your nervous system. These infections would include things like botulism and tetanus. We're going to start by talking about bacterial meningitis, which is the most common form of meningitis and is probably the most important and dangerous type of infection. It's characterized by the sudden onset of high fever that is accompanied by inflammation of the meninges. Spread of the infection to deeper tissues can result in encephalitis, which is infection of the brain, and that can lead to coma and death. There are 5 bacterial species that cause the most bacterial meningitis cases, so we're going to talk about those in more detail. They are listed down at the bottom of this slide. As we review each, pay attention to the differences in how they establish infection. The first important organism that causes meningitis is Streptococcus agalactiae. This organism causes meningitis in newborns because it's acquired during birth. Streptococcus agalactiae, also referred to as group B strep, is present in the normal vaginal microbiota of some women. So, a mom that is harboring the Streptococcus species will transmit the organism during birth and meningitis will ensue. Note, Streptococcus agalactiae is a group B strep contrasting with group A strep, which is Streptococcus pyogenes. Listeria monocytogenes, mentioned in earlier lectures, is a psychotrophic organism that replicates well in refrigerators and therefore is problematic because it may contaminate food. Especially at risk are elderly and immunocompromised individuals and pregnant women because the infection can traverse the placenta and infect the fetus. This picture shows how Listeria infects cells with a unique mechanism. The organism establishes an intracellular infection and then pushes its way into neighboring cells to cause an infection in that cell by breaking through the membranes. It possesses specific virulence factors to be able to do this. It's very interesting. Refer to your book for more details if you're curious. Those at risk are told to avoid specific types of food like unpasteurized soft cheeses, deli meats from the deli counter, and other foods that could potentially be infected with the organism which exists in the environment. The other 3 species are transmitted by respiratory droplets. Now, Streptococcus pneumoniae is present in the throat of 75% of people, so the organism uses some mechanism to transverse into the CNS. Neisseria meningitidis, also referred to as meningococcal meningitis, is mostly linked to epidemic spread of bacterial meningitis. For example, when you think of an outbreak of people housed in a college dorm getting infected, this would be the culprit. There are vaccines available for 3 of the 5 organisms listed here that cause meningitis: Streptococcus pneumoniae, Haemophilus influenzae type B, the Hib vaccine, and Neisseria meningitidis. Further details of the 5 species that cause bacterial meningitis are summarized on this slide. Neisseria meningitidis is a gram-negative organism. It releases lipid A into the body, which can induce shock. It's the form of meningitis that can cause epidemics, and there is a vaccine available. Streptococcus pneumoniae is a gram-positive organism. There's a vaccine available for it, but it's the leading cause of meningitis in kids. Haemophilus influenzae is gram-negative and an intracellular pathogen, and there is a vaccine available. Those 3 are the ones that cause meningitis and have vaccines available. They are also similar in their respiratory transmission. The last 2 do not have vaccines available. However, both have different and unique modes of transmission. Listeria monocytogenes is different because it's a foodborne transmission, and Streptococcus galactiae is perinatal or mother-to-child transmission during birth. That summarized bacterial meningitis. Moving to Hansen's disease, otherwise known as leprosy, this is a disease that is caused by a mycobacterium. This genus has mycolic acid in the outer cell wall. They are gram-positive, acid-fast organisms. So these are the ones that are detected with that special staining technique. Interestingly, the reservoir is armadillos. So in the United States, up to 1 in 6 armadillos carries this organism. They like to grow in the cooler regions of the body, so you will see areas like the nose and fingertips being affected most. There are 2 forms of the disease. Tuberculoid is not progressive, but develops these plaques on the skin. Lepromatous, which is progressive, results in tissue destruction, like you see here on the bottom image. What's the difference between the 2? In the non-progressive type, which is less damaging to the patient, your cytotoxic T cells are the main response to the organism. It keeps the organisms in check and prevents them from causing massive tissue destruction. With lepromatous leprosy, the individual has mounted primarily a B cell antibody response, which is not as effective as the cytotoxic T cells, and this results in a lot more tissue destruction. It's an infectious disease that's transmitted person to person through contact or through respiratory droplets, but it is treatable and preventable. The organism is found in the nostrils and can be tested for and confirmed by the acid-fast type of staining. Patients can be treated with antimicrobials, but these are long-term treatments. This is not a 7 or 10-day course of antimicrobials. We're talking about many months, not days, to clear the organism. There's also a vaccine available called the BCG vaccine, which is really for tuberculosis that provides some protection, but not 100%. The BCG vaccine is used in other countries, but not the United States. Now we're going to talk about diseases caused by organisms that, aside from infection, cause intoxication. In other words, a poisoning. This is due to toxins produced by the organism and not by the organisms themselves replicating and cause tissue damage. These toxins, or rather neurotoxins, can be produced in one part of the body and ultimately affect neurons in the central nervous system. The first of these diseases is botulism, and there are 3 principal ways of getting botulism. First is the typical foodborne botulism that involves the direct ingestion of the toxin by a contaminated food. And then there's infant botulism and wound botulism, where the toxin is produced during an active infectious process. Who causes this? The organism is Clostridium botulinum. Clostridium being the genus, botulinum is the species, and you might remember from our discussions that Clostridia are anaerobic gram-positive bacilli that form endospores. Clostridium botulinum produces the botulism toxin, one of the most potent toxins naturally produced. The toxin works on neurons, which are prevented from stimulating muscle cells to contract. This is the same toxin commercially known as Botox that is used for cosmetic purposes, as well as medical purposes to prevent muscle contractions or spasming of muscles. Of course, the dose of the toxin would be very small to exert the medical effect and not a toxic effect. In cases like cerebral palsy, it has been used to prevent stimulation of a muscle and to allow muscle relaxation. And on the cosmetic use, they don't want you to contract or move a certain muscle on the face, which promotes wrinkle formation. By immobilizing specific facial muscles, the effect is to minimize the wrinkles in those areas. There are not many cases of botulism in the United States, but worldwide it's a different situation. Botulism without some sort of intervention has a mortality of at least 10%. How do you get it? Typically by ingesting food that has the organism's toxin in it. For example, improperly canned food contaminated with this organism provides a perfect anaerobic condition in which it can grow and produce the toxins that you will then ingest and acquire botulism. Here in the United States, the FDA regulates canning stringently. You have to prove to the FDA that your process will kill or have 12 logs, or 12D if you remember D values. 12D reduction of any Clostridium botulinum endospores in the process used to produce your food. This is a huge level of reduction, and it's to absolutely ensure no surviving C. botulism is in the product, because if it is, it will kill people. As you might imagine, these regulations were put into place after incidences of faulty processing led to widespread contamination and deaths in the past. You don't see botulism in the United States from commercially canned products for this reason, but you see it occasionally resulting from home canned products and in products sold covertly in places like farmer markets that escape regulatory scrutiny until an outbreak occurs. In the United States, infant botulism is more common type of botulism observed. Let's talk about that scenario. The toxin causes flaccid paralysis, which is the inability to stimulate the muscles. And without stimulation, you end up with floppy muscles. If you look at the picture here, you have a young child with what's called floppy baby syndrome. The infant is being supported on its back, and the baby is just flopping over with no muscle tone. Because all the muscles are affected, these children can go into respiratory distress because they lose the ability to respire. They can't breathe and will ultimately suffocate without intervention. Among the primary treatments for infant botulism is passive administration of antibodies to patients to help neutralize circulating unbound toxins. Neurons already affected and blocked by bound toxin will need to regenerate the surface where the toxin has bound and block the ability to release the neurotransmitters that will excite muscle cells. These cell receptors must be replaced because once the toxin binds, it's permanent. Acquisition of infant botulism is a little different than the typical foodborne botulism because the infant does not have a good microbiome to prevent establishment of Clostridium in their gut. So, when the infant ingests endospores, they can germinate in the intestine, which is anaerobic. The microorganisms replicate and start producing toxin within the intestines, which is absorbed and exerts the effect on muscles. In this case, with infant botulism, the young infants are ingesting the endospores and getting an actual infection from the organism, which is producing the toxin. In terms of prevention, there are certain foods that they tell you to avoid feeding infants, like honey. Honey is known to sometimes have endospores of toxin-producing Clostridium. So the recommendation is to not give honey to infants less than a year old because they don't have a good enough microbiome to prevent the establishment of a replicating population of Clostridium in the gut. Lastly, for wound botulism, the scenario is this. Imagine a penetrating wound has caused enough damage that blood flow to the tissue has stopped. The lack of oxygenated blood to the site creates an anaerobic environment which the organism can germinate and establish itself, producing toxin. Then that's absorbed into and enters your system to produce the effects of botulism. Tetanus is similar in some ways because it's also caused by Clostridia. This one is Clostridium tetani, also a gram-positive anaerobic endospore-forming bacteria. You acquire the organism through some sort of puncture wound that has created an anaerobic area in your tissue, which allows the endospore-forming organism to germinate and produce toxin. However, the toxin in this case is not botulinum toxin, but tetanospasmin. Tetanospasmin has the opposite effect of botulinum toxin on neurons and muscle cells. The tetanus toxin, tetanospasm, blocks the release of inhibitory transmitters from an inhibitory neuron. So the neuron that would cause your muscle to relax is not actually able to exert its effect. As a result, your muscles permanently go into contraction. And this effect usually starts with a large muscle in your jaw, hence the common name lockjaw. You can see the clenching of the jaw that's happening in this child, and you can see the painful spasming that's happening to the infant in this picture. This is a condition known since ancient times, and here some earlier artwork depicting somebody that's believed to be in a tetanus spasm. Tetanus has a high mortality rate of 50% if not treated, and even higher if we're talking about a newborn. It's almost always fatal if you don't provide them passive protection with antibodies directed at the toxin. The current treatment would consist of passively administering antibodies to the toxin and fighting the infection with antimicrobials. There is, of course, a vaccine available for tetanus. It's part of the DPT or Tdap vaccine, the T indicating protection against tetanus. It's a toxoid vaccine. Antibodies are generated only to the toxin itself. Thus, boosters are needed throughout life to maintain protection. All right, we'll stop here, pick up with the second video.